You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic. She's a board-certified prosthodontist, Dr. Rhonda Jacob. Dr. Jacob, welcome to the program.
Hello, Randy. I am so happy to be here to tell you about my exciting practice and my lovely patients.
Okay, good. Now, I know you brought a lot of photos, so we'll try to get to as many of those as possible. And you've been with Clear Choice for a long time, so the things we're talking about today, you've done thousands of these.
I have.
But for people that don't know Clear Choice, who's the typical patient that's coming in for dental implants?
The typical patient is a patient headed towards dentures and knows they do not want to go into that space. The other patient is likely already in dentures and is suffering from them and has been suffering with them for a long while. So patients lose their teeth for a number of different reasons. The primary one is the kid on the playground, and that may be a future dental implant patient. As that tooth goes through all of the procedures of root canal and crowns, and then failed crowns and another root canal, and then, oh my goodness, the tooth next to that died. It just took a little bit longer from that same trauma. So those patients go through traditional dentistry and usually have one or two teeth bothering them. The next group of patients that we see are dental caries is actually the primary reason, or tooth decay is the primary reason people lose their teeth. It's not as much as periodontal disease as you might think.
Okay.
So all the dentistry that's being done, so the bridge only will last about 11 years. The ADA tells us that. And so the bridge needs to be redone again and again. And often a dentist now has to recruit another tooth to attach to that bridge, because once you treat and retreat a tooth, it finally is a lone soldier there. It can't hold up any longer. Those are the patients that turn into implants. And if you can imagine a lifetime of that with our patients, that they have so many teeth that are failing, and that's where Clear Choice can offer them a fixed set of teeth, their third set of teeth, if you will, and keep them out of a denture. They can go where they are today with those failing teeth, and they can skip the denture process completely. And in one day, after custom planning for those patients, it's like closing a house. You close in one day, but we do lots of planning before them.
Okay.
And on that day of the closing, those patients will have their implants placed, and then they get their new teeth, and they walk out very restored.
Now, is this true that people on the day of the procedure can walk in with no teeth and walk out on that day with upper and lower teeth that don't come out?
Absolutely.
And is that common or rare?
It's common in our institution, it's common in the Clear Choice practices, because the model is team approach, where we have the oral surgeon, we have the prosthodontist, we have the lab, we have our amazing dental assistants that work with us, and all of that is geared to that patient. I tell the patient, we're investing 35 man-hours in you today. You are the person of the day, you and your family.
Nice.
Yes.
Very nice. You know, and we should mention, I guess at Clear Choice is a bit unique this way. So I guess how dental implants are typically done, you go to one place, they do the imaging, another place that they do the surgery, and then there's the doctor that puts the teeth on top. But you have it all right there, even the lab.
We have it all in one place, absolutely.
So aside from convenience, what's the big benefit to the patient?
Well, many of these patients have left dentistry because it's so inconvenient. It's appointment after appointment. And when we have it all in one place, they're seeing the same doctors every time they come. They know that those doctors are all on the same page, and they're working towards the benefit of that patient. And the fact that they can just come and they know that this is their parking space every time they come. They don't have to battle anyone else. They don't have to fight the traffic. We're going to the dentist today, and we're going to have a great experience.
So there's a lot of people, I guess, wearing an upper lower denture, like thousands of people there. If implants are so good, why aren't they all doing it? Why aren't these denture wearers coming in and saying, you know, give me a new set of teeth that don't come in and out?
Well, what baffles me, Randy, is that implants have been in the United States, the type of implants that we use, since 1982.
Okay.
All right, we're looking here at 45 years, and still patients are not getting the implants that they need. It still is just now being taught in dental schools. So when all of my colleagues and I learned how to use implants, it was on-the-job training. It was our own research that we were performing. And so still today, that patient population that's in dentures, they're the ones that in the last 30 years or so had their teeth extracted, and they're still wearing their dentures. And the issue is then that they've left dentistry.
So they don't even know their options?
They don't even know their options.
Okay.
Yes. So I would say they don't know their options, and their family members don't know how much they're suffering. When they think about their grandparent, oh, grandma doesn't go out to eat with us anymore, but it's because her knee bothers her and she has to get in and out of the car with her bad knee. Well, grandma lets them think it's her knee, but it's because she can't eat what they eat.
Is that right?
All
Did
right?
they tell
She
you
doesn't
this?
enjoy. Yeah, absolutely.
So on consults,
They
they will
us
tell
every
you,
day.
like avoid eating
Yes.
or going out with others?
So I have a patient who had not been in a restaurant in 15 years because she had to wear dentures. And she said, I couldn't eat anything. I said, why don't you even go and just have soup? Or why don't you go and just drink with your family members? And she says, no, it's just too embarrassing and depressing. So she has her dentures. She's married to, or her daughter is a physician. She has 4 kids here in California, and she jet sets back and forth between Houston and California now with her fixed teeth. And I'm just so happy
So
for
they can
her.
eat whatever they want?
They can eat
is that
whatever
right?
they want.
Like even with their
Absolutely.
front teeth, like bite into like a raw carrot or whatever?
A rock, I thought
it
you were
doesn't
going
matter.
to say. A raw carrot,
No,
yes,
raw
that's
carrot.
okay. Yes.
So eating is not an issue, and they're never left without teeth. How soon can they eat after the procedure?
Well, a patient obviously is going to take nourishment immediately after the procedure. In terms of their diet, they've just had oral surgery. As I tell them, they'll eat soup and pudding for a few days and then gradually increase their diet. These implants are living, breathing practically, and they attach to the bone. We need to give them a couple
Okay.
months to attach to the bone. During that time, they eat soft food, and then they gradually advance their diet.
All right. How old can you be to get a brand new set of teeth supported by dental implants?
Well, I hear that all the time. I'm too old. The question is, how young can you
Okay,
be?
okay.
You know, we don't like to put implants in the kid who fell off his bike until he's at least 20 years old and he has his facial growth going. But after that,
So what's your oldest patient?
so my oldest patient's 101 years old.
Wow.
So why would a 101-year-old
Yeah,
want to
good
have
question.
teeth? All right. Well, as he said, he's not taking that money with him. That's for one thing.
okay.
He goes on cruises very frequently. In his most recent cruise that he went on, he actually lost his denture while he was eating at the big event. So he said, my next cruise, that's not going to happen.
So on the consult, it's like, I want teeth that don't come out?
Absolutely. And he knows this is the place to go.
So 101 years old.
101
Interesting.
years old. Now, he was one of our early patients, and it's pretty impressive because he sought us out when we didn't have a very big footprint out there. But he knew that's what he
Now,
wanted.
you know, look, most people have seen the Clear Choice commercials. Do people see your commercials, then they come in, and they're still skeptical? Like they say, is this true? Can I really get new teeth?
Well, they definitely can't believe it can be done in one day. And the internet is great. They're looking all over the place in the internet, and they're seeing it. And I like the ones that are very earnest and that come in. The other ones who come in and say, I don't know what I need. I'm just here to have you tell me.
Okay.
All right.
okay.
But these people know that they want implants, and they've been searching the internet, and they've been talking to family and friends, and they are somewhat skeptical about the one-day procedure. And we have this big pegboard out in our waiting room that now has 3,474 numbers on it.
Okay.
Yes, and we tell them that every time we finish a surgery, the patient goes up and puts their number on that pegboard.
Well, that's nice.
And it's very, very, very rare that those patients don't get their denture removed and their implants placed at the very same time, on that very same day. I can count that number in just a handful of individuals, and we told them that would probably happen. Those are the special individuals that we don't turn away. We have to tweak our project and our methods of treating those patients so that they can be treated. But the vast, vast, vast majority get their teeth on the same day.
Very nice. Now, you brought some photos. What are we looking at?
I did.
Let's take a look.
Well, I would like to show you the transformation of some of these patients that we have.
Okay.
This young woman here, she's a mother of 2 college girls, and she's been had her teeth failing. Finally, her 2 anterior teeth broke off. And it was the girls who forced her, made the appointment, told mom what time to be there, called her on their cell phones all week long, making sure that she didn't miss the appointment. So she came in. They themselves were in college, so they weren't with her when she came.
All right.
So we moved forward with...
So those teeth could not be saved.
Those teeth could not be saved.
So she would have had a denture, possibly.
It's amazing to me the condition that some of the patients come in with so many teeth missing, so many gaps, but they'll hang on to those final few teeth for dear life because they know their next step is dentures. And when I asked them if they think that's their next step, and they said yes, that is half the battle right there.
Okay.
That you know that those patients don't want to go there. So this is the after photo on
Let's
this
take a
patient.
look.
She is still in her temporary restoration, temporary teeth. That's what I want to show you.
Wow.
And here she is.
It's made a difference on her appearance for sure. She's got to be
Absolutely.
thrilled.
She looks so much younger.
Yeah.
She looks so much younger. We've established the height of her face. One thing that happens when people lose their teeth is their face begins to get shorter and shorter and shorter. It compresses their lips, frown lines appear. And when we put their teeth back in the right dimension, as they should be, and increase the length of their face, especially the lower third of their face, suddenly it's all youthful again.
So when she looks at the mirror for the first time, I mean, she's got to be pretty happy.
Oh, she's got to be
something like this.
Yeah, they're astounded. They're astounded. They said, I can't believe you said you were going to do that. And sometimes the note we get back from them says, I can't believe you did it. You did what you said you were going to do.
Well, that's good.
Yeah.
Now, her daughters told her to do this. Did you ever get a chance to talk to the daughters? And what did they say?
I saw the daughters. They came for one of their visits. And it was amazing to me when they smiled. They all had the exact same smile. I copied Mom's teeth. The few that she had left gave me a lot of information. And we copied those teeth, and there they were, the three of them all lined up there. And it was just very heartwarming.
Because these look natural.
They look very natural.
So this is all by design. And this is what a prosthodontist does, right?
Yes.
I mean, you're the person that creates the smile, the way it looks.
Absolutely.
We're going to take a quick break. We come back a little bit more about the process, and I know you have more photos that we'll get to those. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. We're here with Clear Choice today. She's a board-certified prosthodontist, Dr. Rhonda Jacob. Dr. Jacob, welcome back to the program.
Yes, I'm back.
Now, you know, one of the things, and we've talked about this in the break, that all of these photos, everybody looks a little bit younger. You say they look youthful. Tell me about that.
Well, I just described how just increasing the length of their face makes them look youthful. So I have to tell this story. This is a preacher that comes in, and tall, thin, probably about 70 years old, Elvis hair, gorgeous hair, and I can't see his teeth. I cannot see his teeth. He talks and if there are no teeth in his mouth. When he smiles, I can barely see his teeth. So he's worn them down. His lips appear long. His teeth appear short. Okay, so I finally convinced him after our discussions that we can help him with that. So we fixed his teeth. We put the implants in. The next morning, he goes to the hospital to minister to his patients in the hospital. So he goes into the first woman, and she sees him, and she says, "John, you look 10 years younger." John was pretty proud of himself. So he goes to the next patient. She says, "John, you look 20 years younger." This sounds like a preacher went into a bar story, right?
Yeah.
So he says to me, he's immediately getting out his little black book to see who else he can visit. He goes, "I'm going to be 30 by the end of the day." So that's really true.
So people, look, it's like anything else in life. If you don't like something about yourself, it may hold you back. So if you don't like your smile, you don't like your teeth, it's one of those things, right? So
Yes.
you see these transformations.
I see them.
You give somebody their teeth back and they're like happier. They're a little bit different. They change a little bit more. Anyway, so photos. What else do you have?
Let's see this guy. When you talk about a transformation and a change in life. So he's a young guy with 4 or 5 siblings, and it's his mother that brings him in. He had dental problems his whole life, and so much problems with them that he actually elected to have his teeth removed and thought he could wear dentures.
Okay.
A young, tough guy, but he wasn't so tough when he had toothache after toothache after toothache. He wanted his teeth removed. However, he disliked the dentures so much that he wasn't wearing those either. And his mother said he became more and more of a recluse. He had a job change, and then he just didn't want to look for another job. So he came in, she brought him in. He was adamant he was not going to do this. And he did not want to do that because he felt he was taking something away from his siblings if Mom was going to help him have this performed. All right. So we convinced him that was not the case. So there he is with his dentures. All right, I want you to see this picture. They don't even look like the same gentleman.
Whoa.
They don't even look like the same gentleman. That is so youthful.
That's like a dazzling smile.
It's a dazzling smile.
It looks good. It looks good.
So this has been almost 5 years ago now. Every now and then he sends me an email and a text. I'm very proud.
What do they like the most? Do they like that they could eat whatever they want, or do they like the way it looks? Like with this one, it seems like the look. What do they tell you?
Well, people, when they come into the consult, often don't want to feel vain, and so they all tell you, "Oh, I just want to eat more. I just want to eat more. I can't eat what I like. I want to have a steak." And so I began looking at them. I said, "Talk for me. I want to see how much of your teeth you show." "Oh, I don't care about that." That's what they say. So I convinced them before we're done. I said, "Okay, all right. I'll fix it so that you can eat." And I said, "And we'll throw in good looking for free." So the point is that most people do want them to look good, and we bring them very much into this, into the process. so that they get to look in the mirror, particularly when we go to their final teeth, so that they're actually able to see those, and we pick and choose and make small dimensional change from the temporary. But I'm very particular that I want my temporaries to look almost identical to my finals. Those patients' entire outlook will change. I don't want to match what they're wearing with the idea that they wait another 6 or 8 months to see what their finals are going to look like. So I like to have those look as close to what is idealized for them as we possibly can. And then if the measurements that we make to make them look nice, to make them chew better, and to make them speak better, all of those measurements validate each other. And you'll have a good-looking set of teeth if you can get a set of teeth that will chew.
And like a young guy like this, if he takes care of them, just like your regular teeth, and they could last for as long as he lasts.
It can last a long, long while.
Doesn't matter.
Yes.
So it could be permanent, possibly.
Absolutely.
Okay.
This one's very unusual.
Wow.
So this gentleman's riding on his bike. He's very, very healthy, rides a bike every day. He's riding it on one of the blacktops there in Texas. And as he goes one direction and a semi comes this direction, thank God it's not the semi that's the problem, but he just touches the end of the semi and a deer tackles him. A buck was running across the road, knocks him off his bike, breaks his upper jaw, breaks his lower jaw. He loses a number of teeth in the upper anterior. Because he was such a younger athlete, he had one of these long bridges that we talk about and broke the teeth that were holding the bridge. So implants were very much in his future. And ideally, we were able to see him then make the changes that he required. The other thing that was interesting is he had had a malocclusion his entire life.
What does that mean?
That means his teeth didn't come together on one side at all.
Okay.
So he had been living with it like that. Then he has his jaw fractured. So we're able to give him a 2-for-1, if you will, replace all of his teeth, have them very nice looking, have them function better, and have his malocclusion corrected.
So his teeth are almost better than they were before the accident.
He's the bionic man. Yes.
And
he's
good.
better with his third set of teeth.
All right, so time for a couple more.
Okay. So this patient comes to us and she is concerned because her teeth are moving and her teeth have spread open. She has gaps between all of her teeth. And that's what we see with periodontal disease. The teeth are losing the supporting bone that holds them in place. The difficulty with periodontal disease is it has a definite genetic component. And sometimes no matter what the patient does, they're not going to get
So all
better.
the brushing, flossing,
all the brushing and flossing, all you do is slow it down perhaps somewhat. So what you see is the teeth start to drift as they lose more and more bone than they drift. So I always tell my patient it's like the fence post on the beach. You know, the water washes in and the fence posts are all leaning, and you take that photograph and it's a great artsy shot, but it's not artsy when it's your teeth.
Yeah.
Okay? So for her, we decided that we would remove her teeth.
So she would have ended up in a traditional denture.
She definitely would have ended up in a traditional denture.
Okay.
The problem with people that have had advanced periodontal disease that need to wear a traditional denture, that bone's already gone. So there's not even the bone to support the denture from the get-go. It's not a matter of losing bone over time, which many patients do with dentures. The periodontal disease patient often doesn't have it to begin with. So we were able to remove her teeth and also place the implants on that very day. And what was very interesting for me is that in discussions with her, sort of close to my heart, is that she ran a healthcare company, she and her husband. And she said that she took care of his elderly father and was so good at it, her husband says, you know, you ought to have a job, you ought to do this. And she was into computers at that time. So all this time they were building this company and they were working with all these patients and she wasn't taking care of herself. And one day he told her, it's time for you to take care of yourself. So when I'm talking to her about her little business, and I said, yes, look at this, it's just wonderful. So I'm talking to her about her little business and I said, so how many patients do you take care of? Oh, quite a few. She says, well, how many employees do you have? She goes, 1,200. I couldn't believe it. I couldn't believe it. So here she was, taking care of all of these patients, taking care of all of these employees, and not taking care of herself. It was her husband who had to push her in here.
Is this one of those things when it's all done, they go, I should have done this a long time ago?
They should have done it a long time ago. I see patients that have come on a consult 3 years ago, and now they're back taking another x-ray. I said, it didn't get prettier. And they said, well, I really got to do something. I really got to do something. And I'll say, I'll tell you the story of this. When patients do that, I'll say, if you'd have done it back then, you'd had 3 years of this wonderful smile and this good function that you have now. So don't make it another 3 years. And
that's very nice. Yes. We're going to take another quick break, and we come back. We have time for probably a couple more photos. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, news that makes you healthier. We're talking about replacing missing teeth with dental implants. And Dr. Jacob says that on the day of the procedure, people literally come into ClearChoice with no teeth and walk out with a brand new set of teeth.
That's right.
And that's common.
Every day.
So you do this a lot. I mean, you're doing this every day. I mean, you're busy doing this every day.
Doing it every day. Close to 400 a year.
And family members, we were talking in the green room, like brothers and sisters do this together, husband and wives do this together.
Oh, that's amazing to me. I have 11 sets. I feel like a doctor delivering twins. I have 11 sets of twin patients. I have 2 or 3 husband and wives, mothers and daughters, fathers and sons, and I treat one, and then they tell 2 friends, and they tell 2 friends, and they come in. I have 2 brothers, and when Joe or John come in, and we'll say, oh, I got the good-looking brother here today.
Yeah.
Yep, it's very nice. And then I had a mother and daughter at the same time I was treating them. I'm not sure I'm going to get this story out. I said, we're going to have a little contest. The team is trying to decide who's going to get the prettier teeth. And I said, when we're all done, we're going to vote on it. And the mother said to me, oh, give my daughter the prettiest teeth.
Well, that's a great story.
That is a great story.
That's very nice. So people doing it together.
Yep.
And it's an exciting time in dentistry. I mean, is this a future, in your opinion? Like, let's say 40, 50 years from now, dentures as we know them today that aren't attached to anything might go away?
Well, we've talked about that, engineering teeth. But all of our engineering right now has been into the implant. And you have to understand that titanium was first used by dentists in the mouth. And now it is the implant material that's all throughout medicine. There's no more stainless steel. There's no more chrome cobalt. There's no more zirconia implants. And so these are so compatible with the bone. And now we have the technology of the iCat, where we can do on-site imaging, and we can manipulate those images in all directions and cut them from slices this way and this way and this way, and make all of this planning for our patients. We're getting better and better.
I have to bring this up, and we're short on time, but isn't it true if you've been wearing a denture like 20, 30 years or 10 years, you don't have enough bone to do this?
That's not true. Implants were invented to keep people out of dentures in 1982 when they came to the United States. That was the whole point. The issue is that patients are being told that over and over again, or they're reading that on the internet, that they don't have enough bone, or they feel that they've been in a denture so long that it's just not possible for them.
So you can work with people if they have limited bone?
We can.
You do it all the time?
All the time.
What if you're on like a couple of medications? Because if you're, like you said, you did a 101-year-old, gave them a brand new set of teeth. Most people in their 80s are on a few medications. So do you have to work with their doctor sometime or their medical doctor?
Well, many of the patients that are needing these procedures, particularly the older patients, are on many medications. Okay. And so we always get clearance from their physician before we operate on them. And often their medications have a great effect on their teeth. And this next patient I want to show you, that's been a problem for him. So patients have acid reflux. It's very, very common these days, and dentists often diagnose it before their physicians do. The acid in your stomach is 100,000 times more acidic than your saliva. And if the patients are refluxing that into the mouth, it just disintegrates the teeth very, very, very quickly. And so what you see is that all the teeth in the posterior are decayed or just washed away down to the gum line. You also may see that they're missing a lot of the back sides of their upper teeth. So the patients that have that problem, it doesn't go away. We've also seen it much, much more in the patients that are having these GI procedures for stomach gastric sleeves and such. That also adds to the change in the valves of the stomach, and they have more reflux.
So they end up losing their teeth.
They end up losing their teeth, and conventional dentistry is not going to fix it because the acid's going to wash over the edge of that crown and decay the tooth underneath the crown.
Is that what I'm looking at there?
That's what you're looking at here.
That's what the problem is?
So this is a gentleman that you can see all of his posterior teeth have been completely eroded by
kind of eaten away by the acid.
Eaten away by the acid. And it happens really quite readily. So when this patient closes his mouth, since he has no back teeth, he's completely overlapping his anteriors. And so his face is very, very short. So he went to a conventional dentist and talked about that. They told him it would be 30, 40 visits. There would be multiple root canals that would need to be done. He would have to have some of the bone cut away to get to the remainder of the tooth to put a crown on it. And it could take him 18 months to 2 years. And he said, I just do not have that time. I'm a busy man.
So when you hear this on the consult, what are you thinking?
I'm thinking that we have the answer for you. And that is why ClearChoice, I think, and this technique has really become revolutionary for many of our patients. It is their third set of teeth. It's their solution.
So baby teeth, you lose those, and then you get your adult teeth, and sometimes you lose those, and now you have your third set of teeth.
Nothing's as good as what God gave you, but we do our best. So what we do for him in one afternoon is extract his teeth, place implants, and give him his new set of teeth to leave. And I have been following him now for 8 years, and this guy is ecstatic And he's an engineer, and he's out on the job. He travels everywhere.
Look at those teeth. Is he on a commercial of yours?
He is on a commercial.
He should be. I mean, the guy looks great.
Yes.
So they
Very, very
smile more.
grateful.
So these people definitely smile more.
They smile more.
Like in life and interacting. We are out of time. So final message to somebody watching this. Maybe they're one of the two categories. Their teeth are really bad and they feel like they're headed for dentures. They don't want dentures. Or they currently have a denture. Now they've heard what you had to say, but they're still afraid or putting it up. What do you say to them?
Well, I say they should come into ClearChoice and have that consult. We do a free radiographic exam. I examine that radiograph, and then I talk to every single patient about the options that they have. And many of them don't understand that they have those options. They also get a feel. We get a feel for each other.
Okay.
We're trying each other on for size.
And you're funny too, by the way.
I am. Well,
You're
I don't know about
humorous. You
that.
have some fun with the patients. So if a patient is watching this, they could go to the website, look at more before and after photos. They get to meet you on the consult. And if they say yes, that means if somebody's watching this and they're in your office today, how soon, if everything works out, how soon can they get their new teeth?
We're usually operating people in 2 weeks, 3 weeks.
So 2 weeks from now, they
Easily.
could have their teeth.
They could have their teeth.
Well, good. All right. I want to thank you for coming to the show. Good
All right.
stuff.
Very nice to meet you.
Thank you so much.
Thank you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.